We hear the term health equity constantly, don't
Yeah.
we? It's tossed around in policy discussions. It pops up in the news all the time. But what does it actually mean? And maybe even more critical, why is getting a really clear, shared understanding so essential if we want public health efforts to actually work?
Well, that's exactly what we're digging into today. We're looking at a really important paper by Braveman and colleagues from 2018. It's simply titled, What is Health Equity? And their main point is something we often, I think, overlook. They say a lack of shared understanding can be a serious obstacle to effective action. It can even lead to, quote, wasted efforts. So this paper tries to give us a really solid definition and unpack what it actually implies so we can, avoid those pitfalls and move forward together.
Okay, let's unpack it then. They offer this two-part definition, which I found quite powerful. The first part, aimed at everyone, basically says health equity means that everyone has a fair and just opportunity to be as healthy as possible.
Yeah.
Sounds simple enough on the surface, right? But the implications, they feel huge.
They are huge. And what's really interesting is how quickly they move to the action part. It's not just a nice sentiment. They say, achieving this requires removing obstacles to health, such as poverty and discrimination and their consequences. And they list those consequences too, things like powerlessness, lack of access to good jobs with fair pay, quality education, housing, healthcare, safe environments. It just shows how much broader health is than just, seeing a doctor. That idea of powerlessness, too, it's not just about lacking money, is it? It's that deeper sense of having no control.
Right. So if that's the big vision, the ideal state, how do we actually know if we're getting closer? How do you measure progress towards something that big?
Yes. No, that's the next logical step. For measurement, they get more specific. The definition becomes health equity means reducing and ultimately eliminating disparities in health and in the determinants of health that adversely affect excluded or marginalized groups. And this brings up a really common point of confusion, I think. What exactly is the link between equity and disparity? Are they interchangeable?
Yes. And this part really clicked for me. The paper draws a super clear line between health equity and health disparities. Equity, they explain, is the fundamental goal. It's the ethical and human rights principle. It's the why we do this. But disparities, those are the actual gaps we can measure, the presumably avoidable differences that tell us how we're doing. So equity is the principle, disparities are the proof points.
Exactly. Well put. And that leads straight into another critical point they make. Equity is not the same as equality. This is so important. It's tempting to think fairness means giving everyone the exact same thing. But the paper argues that real equity often needs more, not equal, effort and resources for groups facing the biggest hurdles. Think about those early anti-smoking campaigns. Good intentions, right? But they mainly reach higher educated white people. So unintentionally, they actually widen the gap in smoking rates between different groups. It shows why just putting the same message out there isn't enough. You need targeted approaches.
That makes total sense. Fairness isn't always sameness. Okay, so let's go back to those big obstacles. They mentioned poverty and discrimination. What are they getting at when they call these the underlying causes?
They really pinpoint poverty and discrimination as the root issues driving health inequities. And crucially, they stress that discrimination often isn't just one person being biased against another. It's frequently systemic, meaning it's woven into our institutions, our policies. Things like historically racial residential segregation in the U.S., or how schools in poorer areas get less funding, or
Right.
financial barriers in the justice system. And this systemic stuff can happen regardless of whether any individual consciously intends to discriminate. It's about the structures themselves.
Wow. So if the problems are that deep, that structural, then the solutions have to be too. We can't just tinker around the edges.
Precisely. The paper really pushes for tackling the fundamental and structural causes of ill health. Address the roots, not just the leaves. And getting back to measurement for accountability, they say it's vital. We don't just look at population averages. Averages can hide large disparities, right? Instead, we need to compare disadvantaged groups to the most advantaged groups. That gives you a much clearer, much more honest picture of the real gaps we need to close.
Okay, so this deep dive really clarifies things. Health equity seems to be this dual commitment then. On one hand, it's about actively working to reduce the health gaps we see now by improving health for disadvantaged groups. And on the other hand, it's about tackling those deeper systemic issues, poverty, discrimination, that create the gaps in the first place.
Absolutely. And linking it all together, the paper really emphasizes that having this clarity isn't just an academic exercise, it's vital. Because, as they say, efforts to move toward health equity will inevitably face powerful challenges. Knowing exactly what we're aiming for helps navigate those challenges. So maybe the thought to leave you with is this. Thinking about your own community, your own society, what shifts do you believe are truly needed for everyone to genuinely have that fair and just opportunity to be as healthy as possible? And maybe even more pointedly, what's one concrete step, big or small, that you think could help move us closer to that vision?